For many years now, we've been getting nationally recognized for our care in heart failure and coronary artery disease. We're able to provide the whole package here locally. We have an amazing team of physicians, cath lab staff, and surgical staff here that provides a comprehensive care for our patients that make this program available here locally. No longer do you need to go to Charleston or Cleveland to provide quality, world-class care. On top of that, for those people that may have even more advanced disease or complex disease, we have our partnership with WVU Medicine in Morgantown and the Heart and Vascular Institute there. We're able to provide the whole package here locally, and when assistance is needed at a much higher level, we have that available as well. Candace is someone I've taken care of for a number of years because she had some atrial fibrillation.
I'm a 74-year-old relatively healthy woman who exercises. I walk over 2 miles 3 to 5 times a week. I swim 2 miles a week. I'm a cyclist, and usually I ride 20 to 50 miles on a ride. I snow ski, and I've been a vegetarian since I was in first grade.
Candace is healthy. She was like my poster child patient. Then she started talking about this discomfort she got in her throat.
I was on a bike ride and I had this tightness in my throat. Not a pain, just a tightness, and it did get my attention, but I ignored it.
After discussing it with her, he said, it's probably nothing. But she said, hey, when she came back, that's still there. So we said, well, let's look into it further.
We were discussing this, and it was decided that I would have a nuclear stress test, which I did, and actually I rocked that test. I did a great job.
She walked on the treadmill for a long time, no EKG changes. Just looking at that part, you thought, she's fabulous.
But it also showed that at some point I had had an infarct or a heart attack. And I'm thinking, that's crazy, how could that be?
And I said, well, maybe it's just artifact. So I said, but let's order another test, just to make certain.
Then I had a cardiac CAT scan, which showed I had 3 blockages.
And I got the results, and I was like, oh my God, she has significant blockages. And we set her up for a heart catheterization.
Dr. Carnum and Dr. Nagy were able to stent.
I think everyone was very surprised. She had the LAD, which is the artery a lot of people here called the Widowmaker, 99.9% blocked.
For Mrs. Jones, there are very subtle symptoms, but she was very concerned about it, and she was proactive and sought medical care, and everything fell in place, and we were able to have a good outcome.
It just stresses the importance of listening to your body, talking to your doctor, and being persistent.
I'm all better. They've saved my life. They really saved my life. And I'm so grateful, and life is good.